Project Workbench.
My name is Matt Munson and I have cancer. It sounds kind of weird actually saying that, but there's a lot of good news. The type of cancer I have is called basal cell carcinoma. It's basically a skin cancer and it's on the side of my nose. It's caused by ultraviolet light. Now I'm not really much of a sun worshipper, but I guess I was out in the sun enough to cause it. The good news about this type of cancer is it's not the type to spread to like your lymph nodes or blood or organ. So it's very localized and it's entirely treatable. The downside is it's in the middle of my face and it's kind of grown a little bit and it's taking up a good chunk of the side of my nose, which means it has to be removed.
I'm Corey Ye, and I'm a board-certified facial plastic and reconstructive surgeon in Orange County, California. My educational background, I did my undergraduate and medical school work at Stanford University, and I then went on to do a head and neck surgery residency at Harvard. I then went on for specialty advanced training in a fellowship for facial plastic and reconstructive surgery in New York. In my practice, we focus specifically on the face and neck, and this is unique to those of us that practice as facial plastic surgeons. And I have a particular interest, which is similar to Matt's case, of restoring someone's appearance when they've been afflicted by skin cancer. And oftentimes we will work with other professionals that include dermatologists and anesthesiologists so that we maintain appropriate removal of the skin cancer, but from my perspective, putting someone back together to restore as closely as we can their natural, normal appearance.
Over the next 6 or 8 weeks, I'm going to be going through that process. In fact, my surgery to have it removed is tomorrow morning. The reason I'm filming this is because I want to document the whole process and maybe help spread awareness of what this thing is and how it can be treated. I'll be getting what's called Mohs surgery, and this is a great kind of surgery because what it does is it minimizes the amount of tissue that they have to remove. The way it works is they basically scrape layers off going deeper and deeper, and each layer they take off, they then run it to the lab next door, check it for the cancer, and then come back and only go as far as they need to. This is a much different technique than what you might be familiar with, where they basically just gouge out huge chunks of flesh and hope that they get it all. The great thing about Mohs is that it's going to minimize the damage done to my face. The bummer is there will be damage to my face.
Matt came to me with a particular problem that involves skin cancer located on the nose. Particular type of skin cancer was called a basal cell carcinoma, which is the most common type of skin cancer. But in Matt's case, which is the reason he came to me, it was very challenging because of the fact that it was located on the face, and in this case located on the nose, and also the size and the location on the nose. There's a very powerful emotional impact that has. And I think the general public can understand that, but as I was talking with Matt, I don't think you can really understand it until you have been through something like this, or maybe you've helped a family member.
I think the scariest part about the surgery for me isn't so much the Mohs procedure, but the reconstruction. It's not pleasant. As of right now, I actually don't know how much skin they're going to have to remove from my nose, so I don't know how much they're going to have to reconstruct. I have a bunch of options, the scariest of which is they take a big flap from the top of my forehead, slice it off, and then hook it down to my nose, and it stays attached to my forehead. So it's really grisly looking for 3 to 4 weeks while the skin attaches to my nose, and then I guess they just snip it off, and then you've got a few more weeks of healing to do.
We don't know exactly how much of a defect there is going to be after it's removed. That's kind of part and parcel to this particular procedure, and that leaves a lot of unknown for the patient, unknown for the doctor, for the reconstructive surgeon.
Another option, depending on the damage, they might take some skin from behind my ear, maybe the tip of my ear, or they might even take some from my cheek. It's really a lot of unknowns, and that's really the scariest part so far.
And I was explaining to Matt, we kind of have to be prepared for the worst. We need to be like a Boy Scout in that way. We need to have all of our options available, so no matter what we're thrown, we have an ability to deal with it. But I did recognize, and I was explaining to Matt, that that's hard for him because he was left with a tremendous amount of uncertainty.
I guess the thing that kind of weirds me out about filming this video is this is going to be the last time that my face as I know it is on film. As much as I try to be optimistic and think maybe the damage will be minimal, maybe it'll just be the type of thing they take a little patch of skin and throw it on there, there's a very real possibility that they'll be taking a big chunk out of my forehead and kind kind of sewing my whole face together. As soon as I finish up here, I'm going to be driving down to Orange County, where I'm going to be having my procedure done by Dr. Algarin. She seems really cool. She looks like Sandra Bullock a lot. And then I'll be heading across the street to visit with Dr. Ye, who's going to be doing the actual reconstruction. Because the reconstruction is so non-trivial, actually we'll be going under general anesthesia, which is actually more scary than the surgery itself. Hopefully everything will go well, and when I see you next time, there'll be some progress. It's the morning of April 2nd, and right now I'm on my way to the hospital. Oh look, here's where we're going for facial removal. It's pretty exciting in the elevator.
Floor 3.
We're in this crappy elevator. It's only a 2-story building.
Floor 5.
Get chocolate milk. Like that was the
Yeah, I
big.
think they'll get the chocolate milk.
That was the big
Yeah, they'll
snack.
get chocolate.
Blood pressure is being taken. Wait, you don't mind being in my video, do you?
No, don't mind it.
Okay, I got your consent then.
Got my consent.
So what room is this? Is this the treatment room? Is this where it's all going to happen?
This is where the magic happens.
Where my nose gets removed? It's exciting, right?
Only little skin cancer.
Now, why do you have to take my blood pressure from a nose surgery?
Just to make sure your blood pressure is normal. It's not too high, not too low.
What if I'm really nervous right now?
Then your blood pressure will probably be high.
Okay.
135/85.
Is that good?
So it's a little elevated, but it's not
I am a
terrible.
little nervous.
Yeah. I'm gonna let Dr. Algarin know you're ready.
Okay, then.
So it'll be just a minute or two, and we'll get going.
I just posted to Facebook my very last selfie with my current nose. So right now I'm waiting for Dr. Algarin to come in and start the procedure. I don't know how much of it she's going to let me film. I'll probably be too focused on not wincing. So it's almost time. It's almost go time. This is the last video of my current nose. See you soon. Okay, so that's it, man. Round 1 of the Mohs treatment is done. They numbed me up real good and then cut a chunk out of the side of my nose. I don't know how much they took out. They put a blindfold kind of thing on me. My face is a little numb right now. My lip is pretty numb. Oh, and it smells like burnt bacon in here because they cauterized a bunch of the blood vessels to stop it from bleeding. It's nasty. So what I'm doing right now is waiting for the lab results. What they do is they take the little chunk of skin and check for margins. They want to make sure they got all of the cancer out. And if not, what they do is they map out where they need to cut further. So then they come in and they take another slice out of where they missed it. All right, take it away.
Okay.
Gross, there it is. I can't even see it, but it's nasty, huh? That's my guts. All right, we just finished round 2. They did some tests of that first chunk of skin and found a little bit left over. So they went in and took out a bunch more along the bottom edge and a little bit along the top. I don't know. I mean, who knows? They might have gotten it all, they might not. I guess this is part of what makes this procedure so not fun, is just not knowing. You know, like I guess 1 would have been great, 2 would have also been great, but who knows? Could be 3, could be 4. Who knows? Well, I'm in the waiting room, and my sister just watched the I Love Cats video on YouTube. I turned around to that. She's a fan now. That's cool. And I just noticed there's a mirror. Look, there's me and my nose, my schnoz. It's gross. So far, so good. Hey, and by the way, thank you to everyone on Facebook who's egging me, or cheering me on. I guess egging me on isn't the right word. Okay. I don't know if we're doing round 3, but we'll see shortly. My mouth is numb. Hey, so here's the chart I was talking about. I guess this shows, like, that was round 1, and that's what was left behind. And then this is the next round, so there's still, you can see the red marks, just a little tiny piece right in there. And so we are going to do round 3, and that's what they're going to remove for this next one. Alright, so we just finished round 3, and I guess there was just a little tiny bit left. And it went really quickly, and I think the vibe I'm getting, though I'm no doctor, is that this might be it. Hopefully they've run that last sample off to the lab to be tested, and I should know more shortly. Exciting news, after 3 passes, they've managed to remove all of the cancer from my basal cell carcinoma on my nose. And my sister Jane is overseeing. Is it nasty?
It's not bad.
All right. So I haven't actually seen it yet, but this is the first shot of my chopped up nose. So I'm very excited because it's all gone, and what I'm going to do now, after they put it, you can continue working.
Okay.
What they're going to do now is just bandage me up, and then I'm heading just down the street a little to meet with my plastic surgeon who's going to do the reconstruction and patch me back up. Okay, so we are done at Dr. Algarin's. I now have no cancer in my face. Oh, yeah. Okay, so we're looking for, I totally forget where his office is. 350, here it is. Excuse me. Hi.
After Matt went through the first procedure, which was all accomplished on the same day, and he had the skin cancer removed, he returned to my office, and we really got a chance for the first time to actually see the extent of where the cancer had extended, and what the result was in terms of what was missing, what had to be removed.
Here we go, first look. I'm at Dr. Ye's office right now. This is it. Ooh, and the stuff's starting to wear off too, so I can feel it a little bit. Nasty.
Are you having much discomfort right
It's nasty. Oh, sorry, I'm just making a video.
We had planned for the worst and hoped for the best. In his case, it was along the lines of what we had expected, but we're concerned about, which was a significant defect and loss of skin, soft tissue, cartilage over the entire area of the left side of the nose. This was disturbing for Matt. This was challenging, and it was obviously the first time he had ever been through something like this.
Hey guys, so I just had my consult with Dr. Ye, and it looks like they're going to be doing a skin flap from my cheek up to my nose, which is pretty gross, but it's a lot less than the forehead. It's a lot less gross than the forehead thing. Anyway, right now I'm just hanging out in Dr. Ye's office waiting for my ride back to the hospital so I can get prepped for surgery.
My role in Matt's care was to reconstruct him, help him put him back together, and to make him whole again. And so it was an interesting and challenging reconstruction, as I talked at length with Matt about, and it's mainly due to the challenges of trying to reconstruct the nose. So in Matt's case, it involved the side of the nose, and it involved multiple areas of the nose. It had to do with the support structure, which is the cartilage, the skin over that area, and the entire structural support of the left side of his nose.
Hey, so I'm at the hospital now, about to check in. I'm admitting. Look at that, it's legit. Boom.
It's for real now.
Matt,
I am, hi.
what are you doing?
Nothing. Nothing at all. Right now I am in my pre-op room, and I'm all dressed for success, obviously. I got my fancy costume on, my surgical cosplay, if you will. My nose is starting to hurt a bit. It's about 1:15 right now, and I'm guessing that the numbing stuff they put into me to chop my nose up is starting to wear off. I think it's mostly worn off on my mouth because I can feel my lips and teeth again. But it's definitely, my nose is definitely starting to hurt a bit. I've still got more than an hour 45 minutes to go before surgery's supposed to begin, so I guess I'll just have to tough it out. Now I just gotta wait until 3 o'clock when Dr. Ye shows up, and my nose is dripping. It's really gross. Alright gang, so here we are, we got the IV in. Nasty. The doctor has drawn lines on my face. They've redone my dressing. I'm like a salad. So you could dress it. Not funny. I think I think I've said this before. This may very well be my last video before I head into surgery. I think I'm pretty much good to go. The doctor seems optimistic, as he should, for God's sake, and I'm all set. So we will see you on the other side. Oh snap! I survived a surgery.
We performed this particular procedure in a hospital environment, and it was a multi-hour procedure that involved a couple of different steps. One of the most important steps was to replace the structural support of Matt's nose. That was accomplished through what we call a cartilage graft. The cartilage graft was taken from his left ear, from this component, and then was placed over the area where the skin cancer was removed to actually provide support and contour to what we call the left nostril or left nasal ala.
So they cut my face up, they cut my fucking ear up, and they sewed part of my ear into my nose, and part of my face into my nose.
There you go.
It's gross.
The next challenging part was there was missing skin and soft tissue, and we needed to cover that cartilage graft. In Matt's case, he had what's called a melolabial interpolated cheek flap. That's a lengthy term to basically describe that we use the cheek skin here to rotate, pivot, and move over this area to cover the cartilage graft and to restore the nose.
I guess it went really well. I was out for about 2 hours, and I don't feel very sick. I'm not nauseous. It just kind of hurts a lot because, you know, they cut my face up. Pretty good sob story.
What's unique about this particular procedure is it is also multi-stage, which means there is a plan to 3 to 4 weeks later detach that connection from the cheek to the nose so that we can finish the repair, put together the cheek, and more importantly, inset that area to reestablish the contour of the nose.
Next step is my lovely sister Jane, fresh from her outing at the CrossFit, is going to drive me back to her place where I can get some sleep and take some drugs. That is what I'm talking about. Anyhow. I always end with anyhow. So that's what's going on. Pretty exciting stuff. So check it out. Get a good look. Get a good eyeful, you freaks. You like that? You like blood and guts, freaks? You'd like that? Freaks. What if I drop my phone on my face right now?
You're not going to be on Ellen now.
No. Okay, so that's pretty cool. Feeling good. Hey, look, here's $80 worth of water and crackers. Check it out. We got a low budget dolly shot here.
Yeah.
Enrique is pushing me out to the car. There he is. Say hello, Enrique.
Hello.
Enrique is my man, pushing me to the car.
You want to run to get the left?
Oh, my sister's sort of leading the way. So right now we're leaving the hospital. I guess it's policy that they take you out in a wheelchair. Probably because they don't want you to face plant on your way out and cause further damage to yourself. Oh, pretty cool. I guess we're about wrapped up here. Next, I'm just going to go back to my sister Jane's house.
The new patio is coming soon.
Oh, Enrique is giving me the full tour. It's an extension, expansion. Nice. Oh, it's a lovely evening. Oh, look, a fountain. It's very romantic. Awesome, man.
In Matt's case, something like this wouldn't come together unless there were a bunch of individuals and professionals working together to help restore his nasal function and nasal appearance. So in his particular case, we were very fortunate to work with one of my colleagues, Dr. Michelle Algarin, who is the Mohs trained dermatologist who physically removed Matt's skin cancer. We had some great support from our office setting that involves Jeanette, my office manager, as well as performing this particular reconstruction at Saddleback Memorial Medical Center. He was under the care of some wonderful nurses, and he was under the care of a very astute anesthesiologist, Dr. Choi, who everyone worked together to really make this particular procedure possible for Matt.
That pretty much ends chapter 1, I guess, of the procedure. I'm done with the hospital. Now it's just a matter of healing up. I've got another little procedure to have done in about 3 weeks where they snip the bridge thing, and we'll go from there. Here's my sweet ride, even now. Cinderella's chariot, all snap. All right, Enrique, have a good night, man. We'll see you again.
Take care.
Time for the slow reveal. Oh, man. Well, I made it back to my sister Jane's house, and I gotta tell you, it looks really disgusting. I have no idea if it looks good, or if it looks frickin' creepy to me, but they patched up. There was just a giant hole in my nose. Most of my ala was gone, so I guess it's a definite improvement. And right now my pain level is actually pretty good. It just feels like I have a headache on my nose, which is not cool, but it's very bearable, very tolerable, but it's moving along. So I guess now is the first night, which is supposed to be the most difficult, and after that it's all downhill. That's how things are going. Hey, this is the morning after surgery. Everyone's still asleep, so I want to keep it quiet. I removed the bandage because it was starting to crust over and stick to my face. I took it off, and put on some of the ointment stuff. And I gotta say, I'm amazed at what a good job the guy did. Even though there's a huge ball of skin up by my nose where my ala is regenerating, you can barely tell. Like, you can see the big incision line where they took out tissue on my face. But man, I was expecting a lot of asymmetry, a lot of sort of tugging and pulling of my face, and like for it to be shaped differently, and it's just really not. I mean, I can see a tiny difference right in around here, and I understand it's swollen right now, and you know it's got junk on it, but I gotta say I'm really impressed. This is far less damage than I was expecting once I heard about the skin flap procedure that we're gonna have to go with. Look at this, got my own private room at the recovery center, known as my little sister's house. Here's the bedside spread. I got some goodies here. Where are you going? You don't know?
You're funny.
I know. That's Astro, and that's my sister Jane, CrossFit Jane, who's been taking care of me during my, what is it, my recuperation?
Your journey.
My journey.
Yeah.
Thanks, Jane. Peace out. Today is day 1 of recovery. I had my surgery yesterday, and as you can see, it's kind of nasty, right?
Yeah.
It's pretty nasty. But that said, the results are a million times better than I expected. Dr. Ye did a really bang-up job. I was expecting a lot of asymmetry, like for one cheek to be sort of pinched together, maybe my mouth to be a little kind of pushed up that way. Overall, though, aside from the swelling, I can barely tell that there's been a huge slab of skin taken out of my cheek. You can see up by the corner of my nose, it's kind of coiled around in there, and that's where it's attaching to my nose, where that new thick tissue is going to take the place of what used to be my nasal ala. You know, it's weird, the hardest part right now is actually in my ear. They took some cartilage out of my ear to rebuild like the lip of my nostril. We have another guest star. And my ear hurts a lot, but my face actually doesn't hurt at all. I didn't end up taking any pain meds, and I feel really good. So far so good, and hopefully the healing will continue.
I think that the real essence of this particular procedure is being meticulous. It's dealing with the skin and the soft tissue. So there's a artistry to that, but I think in terms of the impact on his medical health, as Matt experienced, I think most patients find that their level of discomfort or pain or challenges at home, fortunately, are quite minimal. Now, every patient's different. They might have other medical problems. Matt is fortunate that he's very healthy. So I think the things that were unique to him is a couple-fold. One is his underlying medical health, which is good. Second thing, I think, is the fact that he prepared for this particular procedure. He felt like he did his research. I think he felt like he had good trust in the individuals and the professionals that he was working with. And the third thing is he did a great job following all the commands that we would ask him for as far as taking care of the area after the surgery. And I think by following all those different steps, to my opinion, I think it made for a very successful procedure and recovery for him.
Hi. You guys are ridiculous.
You too.
Say your names. Who are you?
Annika. Ashley.
These are my nieces, Annika and Ashley, and my sister Jane's kids. Hi.
Hi.
So I'll check in with you guys again soon so you can see. I don't expect there to be a lot of changes over the next few days, but who knows, I could be wrong. I'm no surgeon and I've never had this done before. But that's where it stands right now. Day 1 of healing, no pain, having fun. I came home last night, got a decent night's sleep, took a bath today, so I'm all clean and fresh. And I feel fine. I mean, my face kind of doesn't really hurt. It just sort of feels weird. One of the really interesting side effects is the sensation, because you can see the kind of coil of skin that's connected to my nose. That was pulled out from my cheek right there. You can see where that incision is. What's interesting is that when I touch my nose, it feels like I'm touching down here because the nerves haven't rewired. It's, you know, the nerves that used to be here are now up here. So it's really interesting because when I'm like dabbing on this ointment I'm supposed to apply, it feels like I'm touching my face over here. That's my nose. So
The fact that your brain still, when you touch that area, it may lead you to believe that you feel it in the area of your cheek is not surprising at all.
that's kind of weird.
As far as long-term effects, once the procedure has been completed, the brain, we believe, does probably rewire in that way, so the sensations become more of what we would consider to be a normal sensation.
My ear is still a little sore. It's actually the most sore part of my face. If you can believe that, as grisly as that wound looks, it really doesn't hurt much at all. It's really kind of weird. Surgery's amazing. I haven't taken any pain medication, any prescription pain medication. I have been taking the occasional Tylenol, but that's it. I feel fine. It's been 28 days since I had my first surgery where they removed the cancer. Here's a close-up view of what the meat flap looks like. It's interesting, it's actually healed up really well. It doesn't really look raw at all anymore. That's what they're gonna take today and turn into a new nostril for me. You can still see I've got a bit of visible scar here. That's where they took out the skin that makes up that thing. I'm told that's going to heal up pretty cleanly and just leave a very light scar, but it's still pretty significant to me. And you kind of see where I've got some excess skin up here because this whole part was kind of closed off, you know, because they took out a big slab here and then sort of sealed it up. So a lot of pinching and distorting going on. Hopefully that'll all be fixed later today. Anyhow, I'm really excited because this is the end of Meat Flap's reign of terror over my face. It actually is kind of amazing. I'm still really startled as to how well it sort of adhered to my nose and my face didn't distort as much as I had anticipated. So that's what it looks like. And this will be your last chance to see it before it goes away. I hope you've enjoyed it. It's nasty. I'm at the Lugano Surgery Center right now. I'm in the pre-op, just getting prepped to head in and hang with Dr. Ye. We will see you on the other side. This is going to be the very last video, photo, whatever, of my nose in its current configuration. This is it, just finished up, still in the operating theater. Had about 90 minutes worth of surgery. It looks pretty darn good, a million times better than it did before. Still some swelling, a lot of healing to do. But overall, really excited. It looks really freaking cool. And I'm still a little groggy. But yeah, really great. Looks really freaking great. I love it. I love my face. We're now exiting the Laguna Woods Surgery Center. Did I get it right? Mm-hmm. And we have as my co-pilot, say hello.
Hi, hello, I'm the nurse.
It's exciting. Yeah, here we are, and it's a beautiful day.
Wow.
All right. So now on a scale of 1 to 10, Matt Munson is a patient, 1 being worst, 10 being best.
10 would be the best. Best patient of the day, we had 25. You're the best.
Really? You've already had 25 patients in an hour?
Already had 25.
Oh my goodness. Wow, you guys do a brisk business. That's fantastic.
We do. We do lots of different surgeries, and you are number 25.
I'm here in Mission Viejo at my little sister's house, and about an hour ago I got out of surgery. As you can see, I don't seem to be that incapacitated. It was a really good procedure. Apparently it took about an hour and a half for the actual procedure to take place, of which I was conscious the entire time. It was pretty wild. There was 1 or 2 moments where I started to feel a little bit of pain. I think it was right when they were sewing me up. And I kind of just winced a little bit, so then they hit me with a little more of the local anesthesia. I was under a thing called twilight anesthesia. So you're very knocked out. Like it's like being,
pretty trash, so it's not like you're conscious of everything, but in general, awake. You can see pretty clearly from just the texture of the skin which is the replacement stuff and which is the original stuff. And it looks pretty amazing. The symmetry is pretty darn good. It's not perfect, but then again, I am very familiar with what my nose used to look like, so I can see subtle differences. You know, and you can see my nostrils, this nostril is, this part out here is much more swollen. Overall, I think things went really great. My face is still a little swollen and it still looks a little, I mean, there's still some fresh blood on there. There's a lot of stitches, so it's not quite perfect, but just looking at it and looking at the anatomy of what they built, it looks really phenomenal. Still a ways to go, but man, huge difference from just this morning where I had, you know, the big meat flap stuck on the side of my face, and now it looks a whole lot like a nostril. So I'm really pretty darn thrilled. The difference is just it's just outrageous how much they managed to fix with just one little procedure. So I think the next video you'll see from me is probably going to be in a week's time when I go to get my stitches removed. And much like my previous surgery, when that happens, like, the results are pretty startling. By that point, you know, it's been a week's worth of healing and it looks pretty fantastic. I'm bleeding, gross. Pretty exciting day today. I'm getting ready to head down to Orange County once again for my last visit with Dr. Ye. He's going to be removing the stitches from my face. Things are just going to take a couple months, you know, to heal up, for the swelling to go down, for the scars to lighten up. But I'm feeling really good because I think today is pretty much it for this whole adventure.
Hi, Matt. How are you?
All right, here it is. Just got out of Dr. Ye's office, all the stitches removed, and I dare say it looks pretty darn good. Symmetry looks really good. It's a little swollen and it's still a little discolored, and if I look like up my nose, I can tell that the new nostril it's a little swollen, but like from straight on, it looks amazing. The symmetry is just stunning. I mean, the dude did amazing work, and I'm really thrilled. That sort of marks the end of this chapter. My next appointment is in 3 weeks, where we're just going to kind of assess and see if there's anything more to be done or how the tissue's attaching. But really, for all intents and purposes, that's sort of the end for now. It's been about 11 months now, and this is pretty much what my face looks like. I guess the healing's done, and this is what I expect to look like from here on out. I mean, I guess I'll get older, but this is pretty much it. Check it out.
It certainly has been a pleasure for me to work with Matt to help kind of guide him through this process. I think I recognize, having dealt with patients before Matt, that this is something unique. This is something that is very personal, and it's very challenging for a number of different reasons. But it's been a pleasure employing what I know how to do, and to use my skills and my artistry to help Matt get through this process and kind of get him back on his feet again, and to get the nose looking back to normal.
Hey, and as a blast from the past, here's old face Matt Munson signing off and saying thank you for watching this video. I hope you've learned something. I hope the stuff wasn't too gross and you weren't too grossed out. And next time you see me, pretend like nothing's different and you can't even see any damage.
If someone wants to learn a little bit more about my practice and what we do here, the best way to learn a little bit more is to visit us on our website, which is www.facialplasticsurgery.com.
Okay guys, thanks for watching. See you for the next one.